Just a quick announcement before we get into this video. This video does go over 2 different health issues that I'm currently having with both my rabbits and one of my guinea pigs, Honey. And if you're only interested in one or the other, there will be timestamps down in the description in case you're only interested in viewing part of this video. Hey everyone, and welcome back to my channel, or welcome to my channel if you're new here. For today's video, it's going to be sort of like a vet vlog type thing. So I actually have quite a few vet appointments scheduled this month for different pets. So today is January 14th and I am taking both my bunnies, Crow and Luna, to the vet for like a sort of like a checkup type thing. I haven't taken them to the vet and I've had them for a couple of months, and I just have like a lot of questions that I want to ask a vet. So I've decided that I'm going to just take them and have them looked over, do a little physical, make sure they're all healthy, and just ask my couple of questions. So I am going to tell you guys some of the things that I'm going to be asking my vet because I've been like collecting a list here on my phone. So one of the things that I'm going to ask about is that sometimes when I brush my bunnies, they get like bald spots. And I think this is due to the fact that they're molting faster than their new coat is growing in. So like their older coat is shedding faster than the new one is growing in. So when I brush, it gets that loose fur out, but the new coat hasn't grown in yet. So there's bald spots. But over time, those bald spots like do fill in with hair, and hair does start to grow there. So this was an issue that I was worried about when it first happened. But now that I've seen like the hair grow back in, I'm not as worried about it. And then I do want to ask also about the RHDV2 vaccine. I am in the US, so vaccines aren't available in every state here yet. They are available in one state below me, but they're not yet available in my state. So I was going to inquire about like when possibly the vaccine will be available, because I would like to get them vaccinated as soon as it's available in my state. And then in addition, Crow also has some mats on his stomach. So when I went to like brush them and just check them over and give them my own like little physical look over, I noticed that he had like some mats of hair on his stomach, and I sort of trimmed and cut off as much as I could, but the mats go all the way down to his skin. So I'm thinking that they're just going to need to be like shaved off, but I don't feel comfortable. Well, first of all, I don't have a razor. Second of all, I don't feel comfortable shaving his stomach myself. It's such a sensitive area. I would be like okay to do it if it was like his back or something, but shaving his stomach would involve like someone else holding him while I'm shaving it. It's too much worry for me to have to do the stomach shaving. So I'm gonna ask my vet today if they can shave the mats away on his stomach, because they go like all the way down to the skin. And then last thing, sort of, there's a couple other things on here, but the last main thing is that just to confirm that my female bunny Luna doesn't have any sort of medical issues that's interfering with her litter box training. She has been continuing to pee outside of the box, right in front of the box, like every couple of days, once a day, that type of thing. And so I've been working on litter box training. It could just be that she needs more time to pick it up in the new environment, but I just wanted to rule out that it's not like any sort of bladder issue or UTI or anything like that that's causing her to have accidents outside the box. And that's pretty much it. Those are like the main things that I want to ask my vet. So it's really good that I made this appointment, because as you can see, I have like more than one thing to ask them. So I literally have to leave for the vet in like 15 to 20 minutes. So we don't have much time to chat here, but later in this video, I will be taking my elderly guinea pig, Honey, who is 5.5, to the vet. She has an appointment later this month just for like another health checkup since she's a senior. She's got some patches of fur that are missing and stuff, and I just want to have her looked at. So that's scheduled for later this month. So I'm gonna go ahead and show you guys what I've done for the bunnies for their crate. All right, I've got them both in the carrier now. Just a blanket in there, as well as there is some hay in the back, but Luna walked right in there herself, and I just sort of herded Crow into it as well. So it wasn't difficult getting them in there at all. And that's why like having the crate, especially for rabbits, in their pen before you take them to the vet is really great, because it allows them to get used to the crate and used to the space. So like I said, like Luna went in there herself, and then I just herded him in and it's all good. So yeah, we're gonna be off to the vet now. All right, everyone, I am back with an update about the bunny's vet visit. It's actually been a full week since the vet visit, but I do have a little bit of stuff to go over with you guys. So they did a physical exam, and then they also drew blood from both of them. So physically, they were all good. They did do some grooming on Crow, and then they just shaved his stomach, shaved away those mats. And then on both Crow and Luna, they also cleaned the scent glands, cleaned, I think it was Crow's ears that needed to be cleaned. Only one of them needed their ears cleaned out. I'm pretty sure it was Crow. They both got their nails trimmed. So all of that physically, outside, everything is good. They said there's no worries about the like molting patterns. They said it is a bit odd that they're like shedding their fur faster than it's growing and they're having bald spots, but it's nothing to be worried about. The skin looks completely healthy. Like the new fur is growing in like at a reasonable speed. Like there's nothing to be concerned about with that. But then they did blood tests for both of them. They drew their blood for both of them and ran it, and they found high levels of globulins. So I'm gonna kind of try to explain what the vet said. I'm not a vet or a professional, so a lot of this is very new to me, but I'm gonna go ahead and try to share with you guys what she said. But basically it sounds like they have high levels of globulins. Both of them do, but Luna especially. And this means that there is inflammation somewhere in the body, and often they said a common cause of this inflammation is E. cuniculi. I'm not going to go into much detail about the disease. You can do some research on your own, but basically it's just like an infection that can cause inflammation in the body, can cause kidney issues, head tilts a lot of times, brain issues like tremors, bladder weakness, that kind of stuff. So because Luna has been having those bladder issues and those litter box issues, I agreed that they have the blood sent off to be tested for E. cuniculi. So last Friday they did all of that and then sent the blood test off, and it cost me $200 just to have the blood tested, and overall the vet visit was $660. And I'm just sharing these price points with you guys so you can know like how expensive exotic vets can be. And I just got a call back yesterday, so almost a full week later, and they said that her test came back positive. So we only sent off Luna's blood to be tested because since they live together in such close quarters, it's assumed that if one of them has it, they both have it. Luna's test came back positive for E. cuniculi. They also said there was something they looked at in the blood to see if it was an active infection, and that looked positive as well. So because she is showing the symptoms of bladder weakness and going outside the box, and she's been having issues with that, we are going to begin treatment for E. cuniculi for the both of them. I am going back to the vet today to pick up their medication to be treated for E. cuniculi. So basically it is a month-long course of medicine for the both of them that I'm pretty sure I have to like orally give them. So that'll be fun. I've never orally given rabbits medicine, so I'm taking them with the vet to me today to pick up the medicine, and then they're going to show me how to orally administer the medicine on one of them. So that is good that we caught it early, that they're going to get treated. I'm not too worried about it overall. Treatment should work and everything should be good, and they're not having severe symptoms. As far as I see, Crow is actually having no symptoms yet, but since they live in such close quarters, share a litter box, etc., we're going to be treating both of them. And then also updates about the RHDV2 vaccine. So when I went last week, my vet had actually said that they had just gotten the vaccine in and they were going to be rolling out appointments for them to be vaccinated soon. But unfortunately, since both Luna and Crow are having to be treated for E. cuniculi, they cannot be vaccinated until their treatment is done. So my vet will only vaccinate healthy rabbits. So Luna and Crow need to finish their course of medicine and be considered healthy before they can get vaccinated. So that's sort of the plan right now, medicine and then vaccinations. So yeah, I know I breezed through that really fast. And yeah, I'm headed off back to the vet again, and I will be back with you guys when I have the medicine, and I'll probably show you all sort of how I am administering it after I learn how, just so you guys can see in case any of you ever have to administer medicine to a rabbit. I'll show you guys what I'm having to do. And yeah, so I will be back with you guys in a little bit. All right, everyone, I am now back from the rabbit's vet visit, and I have their medication. I'm just going to briefly go over what I will be doing with them for their medication. So the vet gave me two different kinds of medications. They gave me an antibiotic and an antiparasitic, and I will put the names of the medications on the screen. I am not going to try to pronounce them at the moment, But basically, I will be giving those 2 medications for 30 days. So one of the medications they get every 12 hours and the other one they get every 24 hours. And that's basically it for them. Vet pretty much summed it up just like that. You know, I just need to give them these medications for 30 days and that should get rid of the active infection. And then once they are healthy, I can look into getting them vaccinated. And that's pretty much all there is to say about that. I'm really glad I caught it early. I'm really glad they're on medication and they've been doing so well so far taking it. I'll show you guys in a bit how I'm doing medication. I'm basically just doing the bunny burrito method. Their medication costs around $133 for a month of meds for the both of them, which sounds like a lot of money, but when I did the math, it's only around like $4 to $5 a day. So objectively, it could be way worse. So I'm happy the meds were cheap. I'm happy that what they had has an easy solution and that they can just take the meds for a month and then the active infection will be gone. And then hopefully Luna's litter box issues will improve as well. We'll have to see about that. If they still remain after the month of meds are done, I'll have to look into if it's a behavioral issue and not a medical issue. But those are all issues for later. For now, I am just pleased that they are on the meds and that we have a solution and that my vet was able to prescribe them something that also didn't like cost me a ton of money. And also one quick note about E. caniculi, there is potential spread to the guinea pigs. It is a disease that the guinea pigs can contract and can get sick from. However, none of them are showing any symptoms, and the vet also said that the likelihood of them contracting it is really, really low since they're in a completely different room of the house. And I've also been taking precautions to wash my hands between caring for the rabbits and the guinea pigs. So I am taking necessary steps to make sure that it doesn't spread to the guinea pigs, but it is also very low risk. So that is something else I wanted to note, but that is pretty much it for the rabbits and for the rabbits vet visit. Now, getting into something a little bit more serious, yesterday was Honey's vet visit. So I mentioned earlier in this video that I was taking Honey, my 5.5-year-old guinea pig, to the vet, and she was experiencing some hair loss. I'll put a photo on the screen, but she had this missing patch of hair on her leg. So that's when I originally scheduled the vet visit. I scheduled it about a month ago, and then since then her fur has been thinning out on her back as well. So I was worried that she had possibly ovarian cysts, so that was really my main concern for making the visit. But the visit revealed a lot more than just ovarian cysts. So I'm gonna try my best to basically explain everything that's going on with Honey and what I'm going to be doing for her. So first, when we got there, they gave her a physical exam, and the first thing that they noticed was that she had a heart murmur. So when the vet listened to her heart, it sounded like she had a heart murmur, and then moving further down her body, she also felt a mass in her abdomen, in her abdomen area. And then in addition, she had the fur loss and the crusty nipples. So all of that was signs that it would be best to do an x-ray. It was difficult to tell what the mass could be just from the physical exam. So we did do an x-ray. So then once they brought the x-ray results back, there was quite a few things that the vet noticed. So I think the best way to just do this is I'm going to read over the brief vet note that is on my invoice, the summary of the visit, and then I'll get into more detail because there's so many things. You'll see there's so many things interacting with one another in the situation that makes it complicated. So I'm going to read what the vet said, and then I'll get into my personal thoughts and what's going on. On Honey's exam, we noted progressive weight loss, areas of thinning and missing hair, crusty discharge from the nipples, a high-grade heart murmur, and an abdominal mass. Her x-rays showed a normal heart size, but changes present in the lungs associated with chronic inflammation and a mass in the area of her uterus. We also found a stone present in her external genitalia, which we removed. Although her ovaries were not visible on x-rays, I'm highly suspicious that she has ovarian cysts given her external changes. Surgical removal of the ovaries and uterus would be curative. However, there is a high risk of complications with her other conditions. In patients with heart disease, there's an increased risk of anesthetic complications and death from not being able to contract and pump blood normally through the body. We could also go into surgery and find out that the uterine tumor is not removable. Overall, her prognosis is poor for having a successful surgery and recovery. If surgery is not an option, we will treat her with supportive care indefinitely with pain medications and hand feeding. So that is a brief overview of everything going on with Honey. So as they explained it to me, issue number 1 is that she has a heart condition, and the solution to the heart condition is she is being put on medication to manage it. It's not going to fix it or make it go away, but she is now on medication indefinitely for the rest of her life to manage her heart condition. And I'll put the name of that medication on the screen. Again, not going to try to pronounce anything, but she will be taking the heart medication twice a day to help manage her heart condition. Issue number 2 is that she likely has ovarian cysts. I'll put a photo of her x-ray on the screen. I'm not exactly sure what I'm looking at. The vet walked it through with me at the vet, but it's just difficult for me to re-describe that to you all. Her ovarian cysts were undetectable on the x-ray due to the amount of gas in her system, but based on all her external signs, it's highly likely that she does have ovarian cysts. Moving further down her body, we get to the uterine tumor, which is basically like the biggest issue here. So the uterine tumor, as the vet described it, is in a very difficult place to remove. And in addition to this, when she goes under, if she were to go under anesthesia for surgery, her heart condition means she could react poorly to the anesthesia, and the uterine tumor is in a difficult place to remove. So it may take them longer to remove the tumor, or they might not be able to remove it at all. And in addition, she would have to be under anesthesia for an extended period of time in order to remove both the uterine tumor and the ovarian cysts, if they could even remove the tumor. So that means that the chances of everything going right in a surgery for her are extremely low. All of these issues compounded, and I don't know, I was just at the vet, and it was just like this sinking feeling. Like the more we talked and we went over it, and we talked and we talked, and it was like this surgery, the outlook, it does not look good for her. Even if she made it through the surgery, like who knows if she could recover. Yeah, so basically I decided that surgery is just not a viable option for Honey. It's not a risk that I'm willing to take. The odds are like stacked up against her. Like it is such a slim chance that she would go into that surgery and make it out with both the tumor and the ovarian cyst. So basically now I will just be managing her symptoms for the rest of her life, however long she has left. There is no way to know when the cancer formed or how quickly it formed. It's been about 7 months since her last vet visit, so sometime between now and last June, the cancer formed. There's no way to know how quickly or at what time it formed. I would estimate within the last few months, because that's sort of when her gradual weight loss and hair loss began, and that's why I made the appointment. But there's no way to know how quickly it developed, and there's no way to know how quickly it will develop or how long she has left. In addition to the heart meds, Honey is also on a pain med. She's on meloxicam. Again, I'm pretty sure I pronounced that med right. I'm pretty sure I can pronounce meloxicam, but I feel like someone may tell me that I'm pronouncing it wrong. But she's on the heart meds, and then she's on meloxicam once a day to manage her pain. And the reason she is on the pain meds is due to the ovarian cysts. Those could be causing her pain. Ovarian cysts in humans cause pain, so it's assumed that they cause pain in guinea pigs as well. And since it's too risky to operate on her to remove the ovarian cysts, we've just decided to give her pain meds. So my current sort of routine with Honey is that she will be getting the heart meds twice a day, and then she will be getting meloxicam once a day in the evenings, where I will also feed her critical care, and then I will also give her Benebac, a probiotic, an hour after the meloxicam in order to help her gut deal with like the harshness of the pain meds. And that is my plan for Honey. I wish I had better news. I guess good news is they removed that like random stone she had in her external genitalia. I don't know if you guys remember when I read that in the vet notes. That was so random. There was a random stone in her external genitalia, and they removed it. So that, I guess, was a positive of the vet. So that is basically a summary of what I am doing for Honey. The news was definitely not what I was expecting, and it was definitely hard, and I definitely cried at the vet yesterday, but I'm glad that I took her, and I'm glad that we caught it, and you know, I'm glad that I took the initiative to make her a vet visit for that hair loss. If I didn't go and didn't get the x-ray, I would have never known that she needed these heart meds or that the pain meds to manage the ovarian cyst. I would have had no idea about any of it. And I want to thank everyone on my Instagram who has sent me positive messages. I really, really do appreciate it. Yeah, so I'm just going to be doing the treatment and just keeping her comfortable for the remainder of her life. And I will also show you guys how I give her those meds as well. She's a lot easier to give meds to than the rabbits. I also, in all of that, forgot to note how much Honey's meds are going to cost. So her medication for both the meloxicam and the heart meds are going to cost $60 a month. I keep forgetting to talk about the prices because I think it's really important to emphasize how much small pet vet bills can be. So, she'll be getting meds that will be costing $60 a month for the rest of her life. So that's about $2 a day. Again, objectively not that bad, but of course there is still a cost with those meds. So just wanted to mention that before I forgot.
Do you like it? That's it. That's it, all done. Yeah, I know there's no more.
And then as one final note to any of you who have kept up with my channel, I know I mentioned recently that I had planned on getting one of my boars, Cinnamon. I plan on getting him neutered. That was actually supposed to happen yesterday, but due to all of these health issues, I actually canceled his neuter. I will be rescheduling it for a later date. I don't know when yet. I just sort of need a moment to recover from these vet bills and from emotionally from these vet visits before I reschedule his neuter. But I am still going to get him neutered. That is still happening. It has just been postponed for probably another month or two until I just can gain my footing again with that. But that's the update on Cinnamon's neuter. Thank you all for watching today's video, and thank you all for being here with me and for being a part of my pet journey and this channel. I really, really do appreciate all of you for being here, and I am sorry that I had to come on here with such sad news. But again, thank you to everyone who has messaged me, who has been kind. I really, really appreciate it, and just thank you all for being here.